So, tests used to diagnose dry eye disease and to assess efficacy of treatments in clinical trial include the first, what I'm going to speak about today is Sleet and Meibomian glands assessment, then about the conjunctival injection and conjunctival staining, also corneal staining, corneal and tear signs, about the tear film breakup time, measuring in seconds, and also about the Schirmer score, measuring in minutes. And there is a special grading scale, what I would like to show you to evaluate dry eye signs, and I'm going today to tell you in details about each sign of the dry eye disease, and this grading scale you could also use at your clinical practice for the screening your patient for the dry eye disease. So, slit lamp examination, as you know, begins with the evaluation of the patient eye and, of course, of the eyelid position. And it could be relative to the globe as well as evaluation of the Meibomian glands. And examination of the eyelids should be systematic, beginning with the upper lid. And aptotic upper lid may be droop below the normal resting lid position of 2 millimeter below the superior corneal scleral junction, and eyelid retraction or inability to close the lid should be assessed. Eyelid lesions should be examined for size, location, pigmentation, and associated lash loss or ulceration, what you can also see on the picture from the left of the screen. And inspection of the lower lid may reveal lower lid malposition, such as entropion, inward turning, or ectropion, outward turning, and ectropion also of the inferior punctum, through which tears flow to the lacrimal sac, may result in tearing, misdirect eyelashes, may rub onto the globe. So, examination of the Meibomian gland is essential for treating dry eyes. And the most helpful in gland evaluation is meibography by trans-illuminating the lids using the Efron grading scale. And as you see, the normal grade where glands are uniform with a piano cape appearance, no engorgement or stagnation of the gland structure is present. The first grade called minimal changes, so some glands appear normal, others appear engorged and widened with early stagnation of meibum, and the more prominent changes occur near the orifices. And the second grade, mild, where many glands are dilated and engorged, as you see on the picture, with an obvious stagnation of meibum, and there is increased irregularity of gland morphology, especially near the lid margin, and there discrete collection of lipid. Conjunctival hyperemia is a common ophthalmological finding and can be a symptom of various ocular disorders, including inflammation and irritation, not only the dry eye disease. So the conjunctival injection is possible to also to be detected with slit lamp. You could make photographs if your slit lamp allow this, or you can use a grading scale. And it allows the symptom to be used as a metric to diagnose, educate, and monitor treatment. And I would like to pay attention for you colleagues that if you manage more or equal that one or two grading scale, so you could suppose that it's increasing, yes, and also if your patient continue to complain, maybe it's a sign that you you should change your treatment, or patient should be referred to the ophthalmologist. And the scales can be interpolated also into decimal intervals to increase this evaluation more to be sensitive. So about the ophthalmic, the most popular diagnostic tools. As you see on the picture, there are many of them, like fluorescent strip, green lissamine strip, and rose bangle. So I'm going to start to introduce you with the fluorescent sodium strip. So it's used to detect foreign bodies and damages of the cornea. When strips are soaked in the saline, fluorescent dye is appeared as orange color, and these strips are also used for the tear film breakup time. Rose bangle and lissamine green strips are used for ocular surface staining to detect damages of the conjunctiva. Lissamine green is used to stain the conjunctiva and cornea, and it avoids the pain, discomfort, and corneal toxicity that are associated with rose bangle, but it's less sensitive and more transient as fluorescent and rose bangle. So, conjunctival and corneal staining. The Oxford system created the series of panels like a chart, what you can also use at your clinical practice. And these charts are labeled in the letters from A till E of increasing severity. And in each chart, staining is represented by punctate dots. The number of dots increases by 1 logometric unit between panel A and B, and by more sensitive units like 0.5 between each of panels from B till E inclusive. To grade staining, comparisons are made between the panels and the appearance of staining on the exposed intrapalpebral conjunctiva and cornea of the patient. The tear signs. Assessment of the tear film meniscus is quantitative, minimally invasive, direct measurement of tear film quantity, and it has been estimated that the tear meniscus holds 75 till 90% of the total volume of the tear film. Therefore, careful examination of the lower tear meniscus height provides as a simple but clinically useful indication of the tear volume, and also the screening of the dry eye disease.